Hello, welcome back to Remedy, brought to you by Coos Health and Wellness. I'm Eric Gleason. Today we are joined by Rex Ziebeth, who's with the Drug Disposal Coalition. Thanks for joining us.
Certainly.
So you're here to talk a little bit about the Drug Take Back event this spring. So what and when is that?
That'll be on March 30th at the Coos Bay Fire Department, where it's been for several years now. And that'll be open from 10 to 2 on that Saturday.
Okay. So what is it?
That's an opportunity for folks to bring in all of their outdated, unused, prescription change, the doctor told you to stop. This also includes over-the-counter drugs and things, but basically anything that you've got in the drug cabinet or up on the shelf in the closet there that you're not using anymore, a little bin, you can bring those in.
So if you're hoarding your little orange bottles,
yeah,
you
that
can
you
bring
paid
them
a
in.
lot of money for, and then the prescription changed, and you didn't want to throw it away because you paid $60, and there you are.
Okay. So is this event just for residents of Coos Bay or Coos County?
No, it's open. Now of course, we're going to get mostly patients and folks bringing in things from Coos County, but it's open to anybody. We're not going to ask for ID. We're not going to check and see if you're from Charleston or North Bend or Coquille or something. It's open.
You stop by, you can drop off your drugs.
Absolutely. We don't collect any demographic data in that sense.
No data collection
no
as far
ID,
as
yeah.
Okay,
don't want to turn anybody away that's concerned about that. So.
Okay, well that's great. So there's a lot of coverage in the press for the last few years on the opioid epidemic. So has this been devised for the narcotics and opioid problem?
Well, certainly that's one of the drivers, as the drug take back has been coming in the country since 2010 for general take back, but opioids certainly get all the press these days, and for good reason.
Right.
But it's also open for all those other drugs too, which are, if you counted them all, that's the majority.
Sure.
The list of opioids is pretty short, and the list of others is nearly infinite. So there's a lot more other drugs. So both, not just opioids or not just taking controlled substances or narcotics or that sort of thing. So all drugs.
So why is it important for the community to know that it's all drugs?
Well, because folks tend to categorize in their own mind things. Like they think it's first, like we said, opioids are controlled substances because that gets all the press. Or just Tylenol and aspirin because that was a lot of child poisoning for years. So people tend to forget about all those other things that are sitting up in the cupboard there or underneath the sink or someplace that have run out of date, as we discussed earlier. Sure. They're out of date or they're unneeded or they were recalled or read an article to stop taking that.
Right. So is it just for drugs, just only drugs?
No, last year we started as a trial to receive syringes, needles and syringes, generally classified as sharps. These days, many patients are taking prescription drugs at home by injection, not just insulin, which were the traditional favorites, but there are a number of hormonal medications. The anticoagulants, maybe a number of folks have been on Lovenox or something like that at home, so there's quite a number of those too. So disposing of those is really a problem here and nationally.
All right. Well, if you have any of those medications that you would like to drop off, you could go on the 30th to the Coos Bay Fire Department, as well as we're going to put a list of other drop-off locations on the screen. So if you have any drugs, your NyQuil's expired, you've got some opioids that you're not using anymore from an old injury you want to take down, then go ahead and swing by, see them from 10 to 2 on the 30th at the Coos Bay Fire Department. And for Coos Health and Wellness and The Remedy, I'm Eric Gleason. Thanks for joining us.